Hello, Facebook friends. Happy Friday. We're so excited you're here with us today. We are joining Dr. Polo, who has been working all day with one of his incredible patients on a NeoGraft case, and we're very excited to hear all about the procedure and how it's going. So, Dr. Polo, tell us a little bit about what we're looking at over here on our patient.
Okay, well, we're doing hair restoration today on this 30-year-old patient. We're very grateful he's volunteered to share his experience with everyone here. You see his pattern of hair loss here. He's got this deep temporal recession. Again, he's only 30 years old. He's got this forelock that's still maintained with pretty good density, but we're expecting, as time passes, he may lose some more of this hair here in the forelock. So our main goal today is to fill in this temporal recession here, reestablish his frontal hairline, which will be permanent, and then try to get some more density in the frontal forelock here, so that as this thins a little bit more with time, he still has hair that is resistant to the hormonal effects that cause this typical androgenic alopecia or male pattern baldness. So we expect with more time he may thin a little bit more here, and he's already thinning some here in the crown. So we'll show his donor site now. Let's go ahead and lift up a little bit. So this is a donor site, and this is typical with a NeoGraft procedure where we've taken punches of the individual follicular units, and this is what we're grafting now. We'll demonstrate that in a second. But we still maintain enough density at the donor site that he'll be able to have a secondary procedure, years down the line when he's ready for that. And that will depend on, the further pattern of his hair loss. But today we're going to get great restoration of this temporal area and restoration of his frontal hairline and reframe the face. So we're all very excited about how the procedure is going so far.
So these follicles that we're seeing here that have, I guess, already been implanted, that's his actual hair that is being implanted. So it's all him. This is going to be a very natural result.
Follicular units from the back of the head, the donor site there, which is much more resistant to having thinning over time.
That is amazing. And when should he start to see some results from this?
You start to see some regrowth about 3 months, but it's really 6 months where you have nice reestablishment of density in the grafted areas.
Very cool.
We've got some pictures that we can show of his pre-op photos that give a better view of.
And does the patient have to be completely asleep throughout the procedure, or is it mainly just local anesthesia?
Mainly local anesthesia, yeah. This is a nice procedure. Doesn't require a lot of anesthesia. Just for comfort, we usually give Valium, and we give some pain medication, a Vicodin typically. So he took a few low-dose Valium early this morning and one Vicodin and some antibiotic, and then we redosed around midday with another small dose of Vicodin and Valium. So he's been, I think, very comfortable. How do you feel? How has everything been so far?
Yeah, it's been an excellent experience so far. Very professional, very comfortable. I have nothing to complain about it. It's been great.
Yeah, well, we got a great patient. He's
great to hear.
Very tolerant, and he's done great with the medication. He really was comfortable and took a little nap a few times.
Yeah, a couple naps.
But I think has been comfortable throughout. So we're just winding
Naps are always
down. We're
good.
going to finish up with...
Naps mean you're cozy.
Yeah, very super cozy.
We're going to finish up with the final implantation now.
Very cool. We'd love to see some of that if we can.
Okay. We got our team with Carolyn and Lena here, but this is a detailed procedure. I think as people can imagine from what they've seen so far, and it requires a lot of manpower. So the three of us have been working here most of the day, and we got about an hour and a half left. But I think the patient's going to remain comfortable, keeping himself entertained with his book, his phone,
and chit chat.
That's right. Nice conversation. Some good music.
Good music, nice conversation, social media, all the things to keep you entertained for a few hours.
All the necessities.
So these are implanted one by one into the graft sites.
That's right.
Wow.
We've created all of these recipient sites. Just a small needle or a blade creates each recipient site, and then we implant each individual follicular unit, which is anywhere between 1 and maybe 5 hair follicles.
That's amazing.
Yeah, look at the frontal hairline, which is the more natural appearance is to have single or 2 follicular units there. And then further back, we'll put the grafts that have 2 to 5 follicular units.
It's going to be quite a hairline he's going to have there.
Looking
Full
good.
head of hair coming soon. Very, very cool. We'll give you guys a quick sneak peek of his before photos so you can get an idea of what that was like prior to him beginning the procedure and where we're at now. This is fascinating. And in just a few short months, we'll get to see his after photos and the result of seriously detail-oriented people. Dr. Polo, what type of patient would be considered a good candidate for the NeoGraft?
Well, the benefits of the NeoGraft, primary benefit is not having a scar at the donor site. The procedure is also less painful, there's less discomfort, and the recovery times is quicker because of that, because there's no wound. Alternative procedure is excising a strip of hair from the same donor site at the posterior scalp, and then closing that wound with sutures, and then processing that strip of hair into the individual follicular unit grafts. So it's a little bit more detailed, removing each individual follicular unit one at a time, but that's what this NeoGraft technology is all about. And it's, again, less discomfort and no scars. So for patients who may choose to wear their hair short, may have more thinning in that part of the scalp later on, it's ideal to not have a scar which may be visible. And then, the discomfort and the recovery is, of course, very important to people as well.
So once he's fully recovered and healed, and once you start to see the hair growth, nobody's going to even know that he had anything done. There's no scarring, no sign of anything from the procedure after, aside from great hair?
Correct. Yeah, I mean, using this follicular unit technique, which is the modern way to do hair restoration, gives a very natural result at the recipient site. But with the NeoGraft procedure, it also gives a natural and scarless result at the donor site. So it's difficult to get a good look at that. We just saw a brief glimpse, and there are multiple small puncture wounds. But really, we're going to see the patient tomorrow, change the bandage for him, and then we'll see him again in a few more days. But within 2 to 3 days, those sites at the back of the scalp are healed. It's really remarkable how quickly that donor site heals, and really how painless or minimum discomfort the patients have at the donor site with this procedure.
It's amazing. And is there any downtime with the procedure? Is he home recovering for several days?
No. There's really minimal downtime. He's going to be out and about pretty quickly. The main thing is just being careful and protecting the grafts, because we don't want to do anything to harm the grafts, to interfere with the revascularization and the take of the grafts. So it's mostly just being careful. He's got to be careful, of course, about washing his scalp and his hair. So we'll start that after 2 or 3 days, and just very carefully pouring a gentle shampoo over the grafts. But that's the main thing, is just caution, elevation, and trying to avoid any trauma to the recipient site. But the donor site, like I said, within 2 or 3 days is healed, and there's really no maintenance or wound care required beyond that.
That's great to hear. So we're talking about simple, painless, one day, and a few months down the line, you've got natural hair with no sign of a procedure.
That's right.
It's the best possible news anybody can hear.
Yeah, it's a nice procedure, and this is really, life-changing for a lot of patients. Carolyn and I were talking about it earlier. These are really gratifying procedures to do, to make this much of a difference with a procedure that's just local anesthesia and very little downtime for the patient. So probably the most difficult thing is having the patients to wait the 3 to 6 months before you start to see the regrowth. We're all sort of waiting and anticipating that eagerly. And again, the results usually are pretty dramatic and really satisfying.
Well, we will definitely be looking forward to seeing this new head of hair in a few months and that amazing hairline that is already being formed with those grafts. Well, thank you very much for letting us pop in and get a little bit of behind the scenes with NeoGraft.
Okay, we're thankful to the patient for sharing this with everybody.
All right. Give us a call, everybody. Come get your new head of hair. Happy Friday. Have a great weekend.